Alzheimer's disease is one that so many Maine families experience in one way or another, and now state lawmakers are considering ways to make testing and care a little bit easier for Mainers.
Today, impacted families and supporters hosted their annual day of advocacy at the State House. That's where we find News Center Maine's David Guildford this evening. Hi, David.
Hi, Brian. Hi, Amanda. Well, tell me if you've heard this one before. Maine needs more professionals in a very specific field. That's the case for Maine families living with Alzheimer's disease. And a group is now calling on lawmakers to make their care more attainable.
And I want to welcome you to the 2024 Maine Alzheimer's Advocacy Day.
Members of the Maine chapter of the Alzheimer's Association and impacted families came to the State House Tuesday to push for legislative support in the fight against the heinous disease.
We're committed to working to improve access to quality care and support, early detection and diagnosis, and making sure we have a strategic plan to address Alzheimer's in Maine.
Jill Carney and the association specifically targeted three current bills. LD 2125 would create and regularly update a state plan on Alzheimer's. 1718 would create tuition benefits for direct care workers to attract them to Maine. And 1577 would force insurers to cover biomarker testing. The Maine Association of Health Plans testified against it in May. And a spokesperson told us Tuesday many plans already cover the testing and they're only opposed to mandating coverage. Carney argued the test is necessary to find the disease early.
Alzheimer's is one of the costliest diseases to society, and we know that the only way to reduce those costs is earlier detection and diagnosis.
It's not a normal part of aging, and it is really hard on the entire family.
Worker compensation is so low that
Deb Johnson watched with interest. Her husband Dana developed frontal temporal lobe degeneration. She traveled to California for a diagnosis and then cared for him herself while trying to work. She wants others to get the help she needed.
And seeing the bills they're working on, it's like, it almost feels like there's a light at the end of the tunnel, and more people get it.
Now, some bad news in this realm over the past week. The makers of the Alzheimer's drug Aduhelm pulled that from shelves just over the past week, but the association has its eyes on two other symptom-slowing drugs they believe gives hope and a light at the end of the tunnel. Brian, Amanda.
So many families watching this very closely. David Guildford in Augusta tonight. David, thank you.